Hello, and welcome to the Bon Secours Richmond Community Education Awareness Series on Neuroscience. I am Pat Lane, the Neuroscience Administrative Director for Bon Secours in Richmond, and we are pleased today to provide you the Community Awareness Show on neuroscience, and we hope that we offer a wide variety of topics over the next few weeks that will spark your neuroscience interest. At Bon Secours, we provide good help to those in need. So if there are any questions you would like answered or more information, please make sure you call us on our Bon Secours number, 804-359-WELL, or check us out on website at our www.bonsecours.com website. Stroke, unfortunately, affects everyone in this country. Our neighbors, our loved ones, and every 45 seconds, someone is diagnosed with a stroke. But during this segment, we want to discuss with you some risk factors of stroke: hypertension, cholesterol, smoking, and we're going to pay particular attention today to diabetes. March has a special day for diabetes awareness, and March is also National Nutrition Month. So we're going to show you and we're going to share with you some things we hope that will help you to change your lifestyle so that you can have a healthier lifestyle. This evening, I am pleased to host Katheryn Peebles and Andrea Scoik. They're both our registered dietitians and they are diabetes educators. Both are from Bon Secours Diabetes Centers. And we're going to have a lot to talk to them about tonight. So get out a piece of paper or your iPads or your iPhones and begin to take notes on how to modify your lifestyle and improve your health to decrease your chances of having a stroke or diabetes. Again, the risk factors for stroke are smoking, hypertension, diabetes, sleep apnea, obesity, and lack of exercise, and we'll talk about that in a little bit. Our guests tonight, though, are really going to shed some light on modifiable risk factors and things that you have power to change and control and to get awareness about and to alert you on diabetes. So I'm happy to introduce our first panelist, Katheryn. Katheryn received her BSN in Nutrition and Dietetics degree from Virginia Polytech Institute and State University, and she received her certification as a diabetes educator in 1990. She currently is a senior hospitalist, clinical coordinator specialist at St. Mary's Hospital. Katheryn has published an article entitled "Minimizing Hypoglycemia in the Wake of a Tight Glycemic Control Protocol in Hospitalized Patients." And we're going to talk to her a little bit about that and what those terms mean, because I think one thing we want to do is to make sure that you, the listeners, know the terms and jargons that we use as healthcare practitioners. And also, if there's ever a time when we use words that you don't understand, stop us so that we can be able to educate you in that moment. Our second guest is Andrea, and she received her BS in Dietetics from Miami University in Oxford, Ohio. And I said to her earlier that she actually graduated from the same school that my sister did, and my daughter's name is Andrea, so I will probably calling on her all night. She has been certified as a diabetic educator since 1999, and Andrea is a hospital clinical coordinator, Special Diabetes Treatment Center at Memorial Regional Medical Center and also at St. Francis Center as well. This evening, I will serve as your resource on hypertension, cholesterol, and sleep apnea if you have some questions. And we're all going to stress to you today to know your numbers and where to get your resources and help. Callers, we will take your questions between 6:30 and 6:45, and the number to call is 804-915-5202. So Katheryn and Andrea, we are a few days from March 26th. So I want to start off with that. I'm still in my St. Patrick's glory, still wearing green, but I need to move forward. And tell us a little bit about that special day. What does that mean, or what is March 26th?
Well, March 26th is the American Diabetes Association across the whole country is using it as a time for people to become more aware of diabetes, the risk factors. It's not just for people with diabetes, it's more for those who don't have it to become aware of, are you at risk? Do you have certain aspects of you that put you at greater risk? Do you have hypertension? Do you have a family history? But a time for them to be more aware, to be tested. The American Diabetes Association actually has a spot on their website that's called stopdiabetes.com, where you can go and take the risk test to assess to see, are you truly at risk for diabetes?
Okay, and we're going to do that today. I'm going to take the risk test, and I'm going to get tested so that you all can see how it's done. So Katheryn, this is the springtime, and we have the Awareness Day, March 26th, and we're going to come back to that to see if we have any activities coming up in the area. But when is National Diabetes Month? When does that come up?
National Diabetes Month is in November.
Okay.
And there's usually many activities planned that month for people that already have diabetes, but as well as anybody that is at risk or has a family member with diabetes.
Okay. So do we have any community events or anything we're doing special on the 26th? Do we have any of that scheduled, or are we going to put something out about just to go on to get your risk factors? Do we have that already on our website? That might be something we have.
Something
the risk
to put on the
factors.
website.
Mm-hmm.
Risk factors.
Mm-hmm.
We're not planning a screening this year.
Okay.
And I'm sure the American Diabetes Association, they could go on their website and look to see what community activities are planned for that particular day. They would have all of the different sites that may be doing screening, and then you can obviously go on the website and take the risk test. You don't actually have to have a blood sugar checked. You can assess where you are, and do you need to make an appointment with your doctor.
Okay. So let's talk about those risks a little bit, because I want to talk about the risks, and then from that I want to talk about what is diabetes. And we call it a lot of things. I always hear is my sugar is high, so I'll just not eat sweets for the day. So I want to, on this show, to dispel some myths, to really educate how I can remember what I should be doing, and what to look for. So if you can just start with the risk factors, that'll be good.
Well, the risk factors for diabetes, certain ethnic groups are at higher risk than others. You're looking at your African American, your Asian, American Indian have a higher risk than, are at higher risk. You have family members with diabetes, your parents, your siblings, and that puts you at greater risk. Also, individuals like women who had gestational diabetes or had a baby that was over 9 pounds, that puts them at higher risk for diabetes. Your weight is a contributor. Your blood pressure, people with hypertension have a greater risk. So it's one of those we try to have people understand that there are some things that they can't control, but there are other things that they can. By taking your blood pressure medication on time, by watching your weight, being a little bit more active. We have no choice of our relatives and where our culture, where we come from, but there's other things that we can control and make some difference in those risks for us.
Okay, so I want to talk about, Katheryn talked a little bit about hypertension, then we're going to come back and talk about risk, and I'll probably take the risk test at that particular point. But I wanted to talk about, this is neuroscience, and neuro does mean brain, and we're talking about here tonight, we're really talking about hypertension, stroke, diabetes, and what really affects the vascular system. So when we talk about hypertension, we're talking about high blood pressure. And it is sometimes called the silent killer because, and we'll talk about signs and symptoms and how you can be a diabetic, because there may be a little bit of things that you want to watch for. But unfortunately, in hypertension, it doesn't hurt. You may not know that you even have hypertension or high blood pressure. And unfortunately, when we talk about high blood pressure, that's something that is really damaging your arteries. It's that pressure in your arteries. Unfortunately, with the top number, that's what's really pushing against the walls of your arteries. And there are two measurements. The top number is called systolic, and the bottom number is called diastolic. And the bottom number, diastolic, is the one that really lets you, or is a resting point in between the numbers. So when you go to your physician, and this is for diabetes and for hypertension, when they take your test, one of the things that you want to make sure that you know or ask is, what were my numbers? And we're going to tell you today what numbers mean and what test you should look for that. But with hypertension, anybody who has a blood pressure 120 over 80, that is what normal. Below that is normal. So you're looking at under 120 over 80 is normal. 120 to 80 is really in your pre-hypertensive phase. 120 to 139 and 80 to 89. That's what we call pre-hypertensive. So if you're at that level, and just like today, if you go to a health fair or a screening, we don't usually base that on one number. We'll tell you to go back if we think it's higher than what we would like it to be or over a number. We'll say go back and see your doctor or get a trend, or at least have 2 or 3 readings before your diagnosis. And I know there's a special test in diabetes that they'll ask you to do before that as well. But anything from 140 to 159 and 90 to 99 is stage 1 in hypertension. And that's usually when they'll like to put you on a medication. And then 160 or higher or 100 over is stage 2. And if your blood pressure is ever over 180 over 110, that's usually a hypertensive crisis. So we're going to want you to be able to make sure you do that. So we're talking about cardiovascular disease today, and we're talking about hypertension and diabetes. So now let's talk about some of the risk factors for diabetes. Again, and what would I have to do if I want to take a risk assessment? What's some questions?
Okay, so the first question on the risk assessment is usually to look at your height and your weight. So there's a chart to look at that.
Okay.
And weight does play a part in that. And then, have you ever had diabetes during pregnancy?
And that answer would be no.
Okay. And are you under the age of 57?
And that would be a yes. I can say that very nicely.
Okay. Does your mother, father, sister, or brother have diabetes?
And my father did have diabetes.
Okay. Are you Caucasian?
That answer would be no.
And so that is a risk factor right there. Have you ever been told you have high blood pressure?
And that would be yes, which is why I stress this to everyone, and knowing your family history. You know, I've done some shows on that as well. So, you know, the other thing I want people to know is don't look at it as a doom and gloom. So I know that I have in my family history cardiovascular disease because I have high blood pressure, and actually my mother did have a stroke. So I know I'm at high risk for that. I also know that I am not at the best BMI. So, and now if you're really, BMI is over 2 of what it's supposed to be, then everybody is considered obese. So also I know that I have a history of diabetes. So what I want to know, I don't want to be fearful of not knowing, because now there are so many different treatments and things that I can do to have a quality life. So I don't want people to feel like if they get diagnosed with this, then there's nothing else that you can do for me. I know a long time ago when you had a stroke, people felt like you couldn't do it, but now you couldn't do anything with it, that you'd be disabled for your whole life, and so I just might as well not be a burden to society. And so that's not how it is anymore. So we're trying to teach you these risk factors or the early numbers so that you can catch them and to be able to be treated. And also, I want you all to know that these tests do not hurt. So I am going to get my blood sugar taken so that you can see how easy it is going to be. It is, and what is done, and they're quick tests. And so if you can go somewhere and have screening, I know we were at Virginia State University and we did screening, and people were really surprised how quick it is again. And this is something that you can be able to do at any of your screenings to give you that information. So from this, we're also going to talk about some diet things that you can do as well. But we're going to first start with the screening. So I did that little risk assessment. You got to be truthful. That's the other thing I'll say is healthcare practitioners. We cannot help you and get you into the right kind of treatment or give you the right kind of advice if you don't tell the right thing. So
you have a drum in there.
Actually, with this test, we're only going to be doing a
finger stick.
Finger stick.
It's going to do a finger stick, and our with the finger stick, that's one that a lot of times people do it regularly. Sometimes your doctor will do this at the office initially just to see where you are in the range of things. We're using one of the Lansing devices that most people, well, let's try that again. Oh, I got it.
I'd say it looks like it is.
Got it. I don't think I got it now.
Yeah, I mean, it feels like it's just, you see how quick it was. It was really a quick prick. That's a good way to do it, a quick prick to be able to do that. And so what they have to do is there's a machine that's going to read it. My blood will go down into that little strip.
Put it right there. You shouldn't
even
even
hold
jump.
Pressure.
And our goal, very good
Yay.
Number. Our goal,
So go ahead. I won't break any HIPAA laws. I'll tell you since it's such a good reading.
Our goals are for individuals. If you do a fasting blood sugar, we would like it to be below 100. And fasting would be when you've gone for at least 8 to 12 hours without eating. And so, but how do we diagnose diabetes? We usually the number is 126 or higher. Fasting is a diagnosis of diabetes. For pre-diabetes, we're looking at anywhere between 101 and 125. So when we're looking at, and she very nicely has a number under 100, so she's in really good shape. The thing we know is that one number, as we said with hypertension, it's the same with diabetes. A lot of times one number is not what the doctor's going to use. He's going to then do maybe some other tests to validate this and to be sure that blood sugar is accurate and is a true reflection of your status.
So just like I always talk about with hypertension and when you take your numbers, the same will be true. And Katheryn did a great job of telling you that, but at different times of the day, your blood sugar may be different. And so particularly true with blood sugar because it is based on eating. So I don't know if you all want to talk about that at all and advice on when you should take it, or I know fasting if you go to the doctor, but some other
checking your blood sugar. Well, if you're checking your blood sugar at home, a lot of people just get up, they check it first thing in the morning, it looks pretty good, and they think, I'm good. But we really encourage you to rotate when you check your blood sugar throughout the day so you can see what are you before dinner, how did lunch affect you. Sometimes we even ask you to check after a meal, 2 hours after a meal, from the first bite of food to 2 hours later. Your goal is to be back as close to normal, which is 100. If you have diabetes, the goal is under 140. So it can tell you, did I eat too much? Have I been snacking too much? I've been eating properly, but my blood sugar is still high. That's all information your doctor can use.
Okay. So what are some of the signs and symptoms of that I might be a diabetic or something's going on?
Okay. The common symptoms of diabetes are you're going to the bathroom frequently, you're more thirsty than usual, you're very, very tired. You might notice your skin is dry and itchy. And part of the problem with that when it comes to hypertension, a lot of the blood pressure medicines make you go to the bathroom. So you suspect it's your blood pressure medicine making you go to the bathroom when it actually could be your blood sugar that's high. The other concern is that you don't get these classic symptoms until your blood sugar is very high. So many people have no symptoms, just like high blood pressure, and don't realize they have diabetes.
Mm-hmm. So going back to what Andrea said and Katheryn has shown us, very important to know your family history. Just again, these are your pre-screening things that you need to know, and who is at high risk for that. So I don't know if you all know, like, what age should somebody start checking or going to their doctor? Should it be like when you're 30, at a well women's visit, or is there any such recommendation that you know of?
Well, I don't think there's not really a set recommendation. We do suggest that if people have a family history of being sure that their physician's aware, and if you do go to for women for their yearly checkup, that might be the place that you would ask that question. If you, or for your yearly physical with a physician. The thing about it that's sad is we know that diabetes is not age specific. We know type 2 diabetes is in our young people, as we see it in children as well as we see it in adults, where historically everybody thought that type 2 diabetes was primarily for people, for adults. We used to call it adult onset. That's not the case any longer. So that's, in those situations, a lot of times those individuals have a very strong family history. Their ethnic background may make them more susceptible. They also are carrying extra weight. They may also have the situation with high blood pressure. But we're seeing type 2 diabetes diagnosed younger than we would like to see, but much in our youth. Whereas type 1 diabetes is one that, type 2 diabetes, usually that evolves over time when people develop the symptoms and the elevation in blood sugar. Whereas type 1 diabetes is one where their symptoms occur very abruptly. Their blood sugars rise abruptly, and it's usually a very shorter window of time that they can even give you symptoms. And again, that used to be primarily children, but we do still see that in adults as well, but it's not as high a percentage. We see more type 2 diabetes in our society.
Okay. Andrea bought and I want her to show, this is her portion control. And the reason why this is important, again, we're talking about neuroscience, stroke, and diabetes. And for both of these chronic diseases, this is very important. And this is good. That's great. This is what we want. We're talking about portion control here. And again, it's National Nutrition Month. And we're going to talk about, next week, we're going to actually do some cooking in here. It will be very interesting. We're going to do some nutritional tidbits of what you can do with fresh fruits and vegetables. So this is a diabetes nutrition placemat. Andrea, I don't know, you want to talk about it a little bit? I love your portion sizes.
Well, today's plates keep getting bigger and bigger, and so the first thing to look at is what your plate size is. Mm-hmm. And you'll notice that this plate is not half meat, it is half vegetables. Vegetables have vitamins, minerals, lots of good fiber, which has many benefits. And so half your plate at lunch and at dinner should be vegetables. A lot of people don't think about vegetables at lunch. It's a great way to help you lose weight. You want to use vegetables that are frozen or fresh and not the canned because of the sodium that they contain. And so half a plate of vegetables. You'll notice I still have a potato on here. It's one of the biggest myths when it comes to diabetes, that you're not allowed to eat potatoes or bread, and that's simply not true. So we do have a potato. And notice the meat portion. It's about the size of a deck of cards. And then we have some fruit and milk on the side.
Okay, so please remember that the portion size. We live in a supersized economy, or a world that has adjusted to that. And I think we really need to bring it down to your main course and looking at what that size of that circle is. Another tidbit that somebody always told me is that your plate really should be colorful, that you should not have all of the same colors on it. You want to make sure that you have some different colors in there for your nutrients to make sure that you're getting everything at that portion as well. So I'm really happy to see that as well. And while we're talking about food a little bit, and when we talk about stroke, one of the other things we look at is cholesterol. We look at having high cholesterol. So I'll just give you my real tidbit right here. Total correct cholesterol, but we really look at the LDL and the HDL. That's what makes up those. The LDL is what I consider as the lethal of your cholesterol, and so we want it low. So you want it under 100, because your cholesterol is really what causes plaque as well in your arteries. Your arteries, I say, is just like a straw, and you want to make sure that your oxygen, your blood is moving through that. So if you have a high cholesterol, that plaque is forming up. So remember, LDL, and you want it low. Your HDL is your healthy cholesterol, and you want that high, and you want that over 40. And that's what really helps to make your system move forward. So keep in mind with those numbers. So I'm going to have Katheryn and Andrea tell you again what numbers again we want for our diabetes, and I'm going to talk about for not having diabetes. And then also I'll tell you again about hypertension. But we talked about the test. That was a finger stick I got done, and they have some different products here. So you might want to talk about that. And I know one of the things that we like to talk about, people like to talk about, if I do have diabetes, the cost, and how often I'll have to have it checked, and that, because that's an important factor. We found out if people aren't compliant, I mean, there's no need to do that. So.
Well, what we brought with us today were several samples of blood glucose monitors that are available in the marketplace today, and a lot of the situation is that the meter isn't expensive. It's the strips that do have some costs, but if an individual has type 1 diabetes, they usually have to check more often, say 4 to 5 times a day. With type 2 diabetes, if a person's only on oral agent, we like to recommend that our patients check fasting in the morning, and then 2 hours after the breakfast meal, or before a meal and 2 hours after a meal, and alternate days on doing that. And if someone is on insulin, we do recommend that they check their blood sugars definitely each time they're taking their insulin. Ideally, we'd like to have them checked before each meal. Cost-wise, a lot of the insurances do cover. A lot of the companies do have cards that they provide that give people a reduced rate, but you have to just go to your pharmacist, get it set up, go to your pharmacy and see with your insurance what is your preferred meter. What do they have as far as a discount for some of the products with that? With a prescription, the majority of the insurances do cover monitoring supplies. The value of the meter is it lets you see what your blood sugar is now. It gives you more control. It's a tool that helps you to identify what's going on right now. Your doctor will do a test called a hemoglobin A1C test that gives us an idea of what your 3-month average blood sugar is. And our goal for patients without diabetes is to be below 5.8% for that. With diabetes, we'd love for people to be below 7, preferably below 6.5. But it's a test your physician would do. But it's telling us history. This test tells us what's going on right now, and it gives you the ability to manage. Some people think if I don't know what it is, I don't have to worry about it. But sometimes knowing what it is helps you to manage it better.
And Katheryn, it was amazing to me, I do have a little bit of science for graduating from that, but it was amazing to me that they could take one test right there, but it would tell you what your score was, and it's for a 3-month, it's for a trending time from one test right then at that moment. So it's just amazing how science can really be. And you know what, we have not talked about really what diabetes is. So we probably should talk about that a little bit, because I'm looking at 6:30 already. See,
oh, wow.
It goes by really quickly. So how would you explain that to someone?
Well, type 2 diabetes is when the body is not able to use the insulin it's making properly. So the body is making insulin, but when it gets to the cell, it does not do its job. And so the sugar backs up in the bloodstream, and that's when those classic symptoms begin to occur. In type 1, the body's not making any insulin, and they must take insulin to live. So people are often frightened when they're told they have diabetes. They immediately think insulin, and that is usually not the case. Or sometimes you have to be on insulin for a while because the blood sugars were very out of control when it was found, and then you can come back off the insulin.
It's about 6:30, so if there's anybody that wants to call in, please feel free to call in and talk to us, and the number is 804-915-5202. So I know we're going to talk a little bit about what we can eat and exchanges, and what's the best pattern to eat. But ask us any questions you have on hypertension, cholesterol, any of that you would like to talk to us about, or risk factors?
Can I just jump
Sure.
in? There's
Oh,
one
yeah.
more thing. When we talk about diagnosing diabetes, there's two terms that are not favorite terms that patients often hear. The first one is touch of sugar. I have just a touch of sugar. And my favorite is I have borderline diabetes. Borderline diabetes is like being sort of pregnant. You can't be sort of pregnant. The criteria is very specific for diagnosing diabetes. And if you're above 126 fasting, that blood sugar is above 126, you have diabetes. Now, whether it's going to be managed by diet or pills or maybe some insulin, that's determined by the doctor. But when people hear a touch of sugar or borderline, they don't take it seriously. And then by the time they do, the blood sugars are uncontrolled.
It's really why we want you to know your numbers today. I mean, seriously, if nothing else that you remember, we're going to tell you to know your numbers and then to take action on your numbers. It's the same thing with hypertension. If you are above over 120 over 80, people used to say, oh, it's mild. It's pre-hypertensive, leading you down a road, if you don't treat it, to get worse if you don't get treated. And your treatment could be, like we said, diet or exercise or just being aware of that or taking it more frequently to see what it was. And I would strongly suggest journaling or taking or being able to write down what you do to kind of keep a record. And now I know if you are someone that has an iPhone or a smartphone or iPad, you know, they have so many different applications now that make it really easier for you to be able to do that. So really pay attention to what those numbers mean and talk to that health practitioner when you're there. And there are so many resources and applications that are online that can be able to help you to be able to look at that as well. So March 26th is an alert day for diabetes. So we're going to challenge you to at least go on the diabetes website to be able to look and see if you are at risk for that and then take the next step to that. I don't know if there's some people out there watching. I know Shaka Khan and Patti LaBelle. Patti LaBelle actually has a great cooking book for that. She says she's a diabetic and it's not going to get hurt. So, you know, you can make those lifestyle adjustments, and they're very active with that. But again, if she didn't take control and know what she wanted to do to know what it was, then she wouldn't have that to be able to do that. So what else with diabetes that you would like for us to know?
Well, one thing you had mentioned earlier about when you were talking about cholesterol and the HDL and the LDL, and one thing that, as you said, your blood vessels are like a straw, and then these different things will build up, the plaque will build up. Well, what we know with diabetes is the higher your blood sugar is, the thicker your blood is. When your blood gets over, if your blood sugars get over 200, it's like having K-Rose syrup running through your veins. Well, then the problem, why are people with diabetes at higher risk for strokes? Well, kind of makes sense. If your heart's trying to pump thick, gooey stuff, it then makes the heart has to work harder, so your blood pressure goes up. And then also because it's nice and sticky and gooey, it allows all that, the lethal cholesterol, the LDL, a lot of times it's kind of lazy and it likes being in a sticky environment. So it keeps building up and staying put to the point that you can then have either plaque break off, but it can't move, so you have stroke. So we always encourage folks to realize that when your blood sugar is over 200, it increases your risk for all the things we've talked about today, hypertension, for stroke, and it also increases the complications related to diabetes. So I try to tell folks, if you think about it that way, it kind of gives you a little bit different perspective on what your blood sugar is doing.
And one thing that does hurt both our chances when we're talking about oxygen and blood and circulation, and I would be remiss if I didn't say this, is smoking. Smoking is something that for diabetes and hypertension and cardiovascular disease, they don't go well at all. I'm just going to say they don't go well at all. And while we recognize as healthcare practitioners now that smoking actually, it is a habit and it's very difficult for many to stop, there are things that we can do and provide for you to help you with stopping to smoke. Because if you stop smoking, the reduction in the help that it will help you with your hypertension and diabetes is tremendous. It's phenomenal. We can show you some statistics on that. We can actually, you'll feel so much better with your exercise in your lungs, and that will come back very quickly if you do stop smoking. That is one thing that I want to say as well. But then there's the catch-22, because people say if I stop smoking, then I have to eat.
I need to eat.
I need to eat and get that out, so we can talk about that. So if I am, other signs and symptoms that I've heard, perhaps I get a sore, and I usually heal pretty quickly, but for some reason I'm not, or I don't heal as frequently as as what I used to. Could that be a sign of diabetes as well? Or
That is another classic sign that you have cuts and wounds that don't heal properly.
Okay. And then I want to talk about a little bit about food, in that I've heard a lot of times that you say, well, if I just cut out all my sugar in my diet, then I don't have diabetes, because diabetes is just sugar. So can you talk about, and you talked a little bit about your potato, and that's a myth about carbs, and what kind of, it should be a balanced diet, and how do we do that, or how do you teach with that in class? So talk about, well, we'll hold that thought, and we have a phone call. Hi, caller. Thank you for calling in.
How you doing? I'm really enjoying that show. Real informative. I have a question.
Sure.
My son is diabetic. He's been diagnosed since he was 6 years old, so he's type 1. And my question is, how safe is it for people with diabetes to live alone? Because I know some of the experience we had with him. I'd just like to get your input on how safe it is for people that are diabetic to live alone. Thank you.
Thanks.
Well, I know that of course, I've had a number of patients that do live alone, but a lot of times for people who live alone, they have to be more aware of checking their blood sugars more frequently. They, want the importance of good glucose control and appropriate meal planning and things of that nature. There are a lot of developments today in technology that has become very beneficial to helping folks who might not have real good glucose control, to help them to figure out where their difficulties are. There's continuous glucose monitoring systems that a doctor will use a lot of times to help people to figure out where their ups and downs are, so that they can tweak and make their regimen more specific to them. Some people who wear insulin pumps, actually with these continuous glucose monitors, actually have ability to warn them. They have alarms on them to let them know when their blood sugars are getting to a certain level, so they can kind of be pre-prepared for it. So the better controlled an individual's blood sugar is, and the better we can get to them to seeing what their trends are, the safer they can be.
Okay. So now, is there such a thing as, okay, I know I said in your article, which we can talk a little bit about too, the term was hypoglycemia.
Yes.
And hyperglycemia, if you could just talk about that. And then, is there a danger level of going too low, and is a danger level for going too high? And what should I do in both cases?
Well, hypoglycemia is, hypo means low, which means your blood sugar gets too low. And some people feel those symptoms when their blood sugars are just barely under 70. Some people can have a blood sugar of 20 and not feel their symptoms at all. So hypoglycemia comes on very quickly. So that's why it's really important for folks, if they do know what their symptoms are, to check their blood sugars when they feel them. And there's individuals who have a tendency not to be able to tell they're having lows, which usually happens in folks who've had diabetes for a number of years and maybe have had a lot of variability in their blood sugars. That's why the meter is so important, that they check their blood sugars. So when we're talking about low numbers, we manage and we tell patients, if your blood sugar is less than 70, we want you to treat it. We want you to give yourself something that's a rapid acting glucose that'll help to bring that blood sugar up. Might be juice, any type of fruit juice will work. It may be some type of glucose tablets that are available. We also, some people, well, actually a critical value is less than 50. It's what we consider to be a truly critical value. But folks will find out, who've had diabetes for a while, will find out where's that number that they feel like they really are not able to function as effectively as they need to. But hypoglycemia does happen quickly, and it needs to be managed in a prompt manner.
And I think the caller was really good in saying this. And one thing we want you to know is that you're not alone, and you shouldn't feel alone, and you shouldn't feel ashamed if you have any of these things, because they're very treatable. So you want to make sure that your family members, your loved ones, or somebody does know your history, so you can be treated really fast with say a cup of orange juice if somebody is there. If you're driving, and you might want to make sure that you keep some snacks in your car and have a safety kit for you there as well to make sure you do that. I'm from Washington, D.C., so if you're stuck in traffic and you're a diabetic, that could be a factor. So you want to make sure that you have some type of snacks with you so that you can be able to be safe. Now, hyperglycemia is high I'm going to say high blood pressure because I'm talking about hypertension, is high blood sugar. So talk about that. If it's too high, what do you see?
High blood sugar is above 250. Okay. And that's where those classic symptoms start. If the high blood sugar is caused by what you ate, obviously watching what you eat better is one way to help it, and go take a walk. Exercise will help bring down a high blood sugar. Other reasons blood sugars could be high, you're worrying a lot about something. You're under a stressful situation, so managing your stress is a way to bring down high blood sugars. Sometimes people just need to drink some water and wait it out. It happens now and again that the sugar is high, and they panic because they're not used to seeing a high number. But we just tell people sometimes you just need to drink a glass of water, sit back, relax, and then check it again in a little while.
Callers, there's a lot of parallels if you hear it about diabetes and hypertension. If you have hypertension or high blood pressure, we'll tell you some of the same things, just to sit and relax. Hold on, we'll get back to that thought. Hi, caller.
Hi, I'm concerned my blood sugar.
Uh-huh.
I was on metformin, and my doctor, he took me off there and put me on something else called GILIPIZID.
Glipizide.
Just 5 milligrams.
Glipizide.
I was wondering why did he do that? Is it because my sugar's better or what?
So one caller, did he tell you what your numbers were? Did you know what your blood sugar number was when he?
One time it was very high. It was 286 one time.
Okay.
And then they put me on that metformin, and then it went down.
Okay.
So then I went back to him the other time. He told me that for me to stop taking metformin and take this, give me another prescription and the name of ZIPIZID, which is only 5 milligrams. Does that mean my sugar is better or what?
So the one thing I would love for you to do is go ask him what was your blood sugar when he switched it. I'm sorry, I'm talking to you on the phone like I can see you. But anyhow, the caller, go back and ask him that. But I'm going to let these ladies talk about the different medication management and why.
I thought it was better. Why you took me off metformin?
Well, metformin is
I'm going to hang up now so you can listen.
Okay, thank you.
Metformin is one kind of pill. There's 4 kinds of pills. So metformin is one kind, and if the doctor didn't feel your blood sugars were coming down well enough, he switched you to a different kind. So the milligrams don't matter. It is a smaller pill, but it's doing a different job in your body, trying to bring your blood sugars down further probably. So he probably was concerned that your blood sugars were still too high, and so he decided to try a different kind of medication that has a different job in the body.
And see, caller, that's another thing I want to really stress as well. That's why it's important for you to go to your doctor and have a great rapport with whoever, feel comfortable talking with whoever that healthcare practitioner is. One, some of the questions, and these are crucial conversations, do not be afraid to ask them because we're talking about you and your body. So you want to say, how am I doing? This is what I've noticed. If you're changing the medication, you ask, why are you changing the medicine? What was my number? And sometimes he may just say, well, you know what? I think this medication may work better for you because. Or caller, you may be on another medicine, and some medicines work better together. They're chemicals. They just work better together than some of the others. And we didn't talk about it, and I want you to think about it. Some medications also may cause more side effects, and so they may not want you to have those side effects, so those side effects are leading to something else. So don't ever be afraid to ask your practitioner what your numbers were, what are your treatment, and don't be afraid to say, well, how long do you think I'll need to stay on this? Will this be the medicine that I always will be on? Will you change it? Are there things that I should look for to say that medicine really isn't working for me? And when should this medicine kick in? That was one thing when we're teaching our patients for hypertension, if their blood pressure is high, we want to tell them kind of when do you expect them to see in a different range. So setting goals together with your health practitioner is very important. I'm going to turn it over to Katheryn and Andrea to see if they have any other thing they want to say about that.
Well, I think that's a big thing. We always tell our patients, talk to your doctor, go and ask questions. If there's things that are bothering, go prepared with information. Ask questions. They want you to be informed. That's a big part of it. Education plays a really big role in your understanding why they're asking you to take the medications you're taking and why we ask you to modify your food intake. What is it about your dietary regimen that would help you a lot? Sometimes for some people it's a matter of maybe changing a beverage, so it could be just make some simple modifications.
Hello, caller.
Hi, just a question. Once you've been diagnosed with type 2 diabetes, is there any natural way to bring that up to normal, to adjust that other than medication?
Thank you.
Okay, thank you.
Well, one of the things we know is depending on how high the blood glucose is when you're first diagnosed, if your blood sugars are elevated but not extreme, a lot of times the physicians will say, let's look at diet and exercise to help with that, and balancing out your meal plan, eating more consistently, having some regular exercise, working towards, once you get your blood sugars better controlled, working towards some weight loss. There are no other natural items out there that have been found to be effective in maintaining glucose control as far as other natural herbs and things of that nature. But we do know that some folks can do it with the exercise and dietary modifications if when they're first diagnosed their blood sugars are not really extreme.
So let's talk about diet. And I said we run out of time is moving quickly. But I wanted to talk about that too. Very important if you're a diabetic to eat. Mm-hmm. And to eat consistently. And I'm going to turn it over to the ladies because that one is, I know you can't not eat in the morning and just eat at dinner saving your calories. Because I know a lot of times you want to lose weight, you want to say you're on a 1,800 calorie, I got to lose this weight. But you can't do that. And I'm going to turn it over to them to talk about that a little bit.
Our number one rule is 3 meals a day. Mm-hmm. Very important. Your body needs energy 24/7, and starving yourself all day so you can have a major pig out at night is not effective for weight loss, not effective for blood sugar control. A lot of people say, I don't like breakfast foods. Well, I don't eat breakfast foods. You can have a grilled cheese. You can have leftovers from the night before. As long as you have something. And the important thing is that it includes carbohydrate foods such as grains and dairy products and fruits and vegetables to give your body that energy it needs to get through the day.
And one of the things too that a lot of folks think that it's only food that causes your blood sugar to rise, and we've talked about that there are other things that contribute. But I've had patients that say, now I'm not going to be able to eat anything that I really like anymore. And as we talked earlier, portion control is very, very much a factor in how to maintain good glucose control. We're not saying you can't have a potato. We just don't want you having one the size of a football. And we're not saying you can never enjoy a small piece of birthday cake. We just want it to be an occasional thing, meaning when it's your birthday, you can have a small piece, but don't have the piece with all the icing on top. But you have it as part of a meal. And to have people understand that having the variety of food at your meal then allows your body to absorb the carbohydrates and the starches into glucose more gradually than if you just have those things by themselves. Beverages are a big factor because we're in the South and people love sweet tea. Well, sweet tea can be a real detriment to glucose control because it's liquid, it's absorbed quickly, and a lot of times if people come to us who are newly diagnosed, I'll ask them if their blood sugar's been up, what have you been drinking? The only thing quenches my thirst is they'll tell me either sweet tea or fruit juices. And one of the physicians said when patients are drinking only that they think can quench their thirst, he said, first thing I do is check blood sugars. Mm-hmm. And water's wonderful. Try to get people to drink more water.
Yeah, and that's good for everything. Again, water, 6 to 8 glasses, and that's really nothing. Remember, your body is really made up of mostly water, and as you're moving around, that water goes. So you're depleting it all the time. So again, caffeinated beverages are also something that also depletes your water, and so you're working harder to get that done. I lost my train. It was something else that you said about food. I just wanted to make sure that you remember to eat constantly. But what we didn't talk about also was reading food labels. I wanted to talk about that for a little bit, especially for hypertension, and we talk about reading food labels, and somebody may say, oh, I'm a vegetarian, and so I just eat, I'll eat all vegetables. I say, okay, what are you eating? They say, oh, I just go get a can of string beans, a can of spinach, a can of kale, and the sodium in that is very high. So I'm sure the same thing with canned fruit. So I wanted to talk a little bit about that, how you read the labels, what are you looking for on that label.
The most important part of the label is the serving size. So most people glance at that and then go and eat whatever it is they normally eat. So sometimes you need to get out the measuring cups and just see what a half a cup or a cup of something looks like. Then, when it comes to diabetes, the more important place is the total carbohydrate, not the sugar section. The sugar section now shows you naturally occurring sugars from milks and fruit, and those are good for you. And so you might be eliminating foods you think you can't have. Canned fruit is acceptable if it's in its own juice, but it's still going to show that it has sugar in it because fruit has natural sugar in it. So you have to do some label reading. So those two are more important. Increasing your fiber. So that's right below the carbohydrate section. The more fiber, the better.
You have anything else on that, Katheryn?
Well, when you're looking at a label too, like you were talking about with sodium and such, a lot of people just don't realize that it's the portion size that's on the label. The amount that's there is for that portion. And when you're looking at the sodium content, I always tell folks, pick up something like we were talking about canned vegetables. Canned vegetables are higher in sodium. Frozen vegetables don't have the same sodium content. Mm-hmm. Then you can add other herbs and spices and seasonings for that. The same way we talk about concern about cholesterol. We know that individuals with diabetes are at higher risk for heart disease. So we always talk to them about keeping their sodium content in control. We also talk to them about keeping their fat, the fats and stuff in their diet. But it's not a matter you can never have any type of fat. It's making better choices of the type of fat to hopefully have less LDL build up and to improve that. So when they're looking at a label, they want to look at the saturated fat as well as those that have the polyunsaturated fats. Saturated fats are something you want to minimize. Trans fats you want to minimize. But when they need to compare, looking at a frozen vegetables, compare it to a can of green beans and see what the difference is as far as the sodium content. And a lot of times folks are phenomenally amazed. The same way when we tell them to start looking at cereals. Pull up your cereals and look at the amount of fiber, because there's a lot of cereals out there. They may not have a lot of sugar, but they don't have very much fiber, so the body absorbs them very quickly because they're very processed.
Mm-hmm. And one of the things I tell people also too is a grocery store hint. Always start on the outside. Start on the outside, because that also gives you a little bit more. It's a nice size grocery store, then it gives you a little bit of exercise, and then you put some music on and get from the outside, and you can go into the inside. And hopefully by the time you've done the outside, your cart is almost full for that, so you can get some exercise in. Exercise, though, is important for hypertension and also diabetes. It can bring down, if you do exactly what you said, at least 30 minutes 5 times a week for hypertension, very important. Keeping that stress down, very important. For diabetes, if you're a diabetic, I wanted to talk about exercise a little bit, because I think with that, you really need to check your sugars. And if you all want to talk about that, you probably have a
to relate to checking your sugars with exercise, we always tell folks, if you're an individual who goes to the gym, if you take longer walks, you don't walk before you eat dinner, walk after dinner when you know you have food on board. But we encourage people to check their blood sugar before they start an exercise regimen. The same way we tell people, if you're getting in the car and driving to DC, check your blood sugar before you get in the car. Be sure it's in good control. Take some extra snacks along with you, so that that your blood sugars will be more stabilized. Same way with exercise. We tell folks, if you're going to go do some more rigorous exercise, check your blood sugar. If it's over a certain amount, if it's under a certain amount, we have you eat 15 grams of carbohydrate, or we may have you eat a piece of fruit. Then we may have you, if it's even lower than that, we might have you have a sandwich before you go out and do your exercise. So monitoring is important, but taking a 30-minute walk, sometimes people say, I don't have that much time at once. We'll take 2 15-minute, brisk strolls. But if you take it right after a meal, that kind of helps to avoid the low blood sugar that might occur.
Okay. So we're getting down to the wire, so we're going to go around. Andrea, I know it went by fast. It went by very fast.
It went by very quickly.
So do you have anything that you usually tell people when they come and talk to you, or anything you want to share with the audience?
I just encourage my patients to have a wide variety of foods, that there's nothing they're not allowed other than the beverages need to be unsweetened. To enjoy their food, try new veggies, try to think about ways to get half a plate of veggies at a time.
I got one question that everybody always asks me, and I'm glad you all are here. They always ask me what is best. Splenda, what is the other one? Equal,
Sweet and
the
Low,
one in blue, or whatever. Can you just please talk about that?
It's whatever your personal taste preference prefers.
Okay.
They're all safe. They're all on the safe list. There's a lot of information that's wrong out there about NutraSweet that's just simply not true. So whatever, I have people tell me Splenda tastes the sweetest, and then I have people tell me the old Sweet and Low and the pink packet tastes. So it's whatever you prefer. Some of it's more expensive than others, so what's good for your budget? So whatever you like.
Okay. Katheryn, you have anything else you want to say?
Well, I think one of the things that I try to help my patients with is to have them understand. So we ask them to monitor their blood sugar, which is something they've never done before, and we're asking them to make some dietary changes and add medications in. But we try to also tell them what motivates you to want to feel good, what motivates you to want to feel better. And as Andrea talked about, the effect of stress, it's also the sense of personal well-being, of knowing what's your motivation, what's the thing that makes you want to get out there and take the walk. It's not just making the doctor happy. You're the team captain, trying to have the patient understand they're the lead. Your physician is your coach. Your diabetes educator is your coach. The nurse is your coach. So to kind of see what's my role as a patient? What's your motivation to be sure you get good? One patient was, I want to walk my daughter down the aisle. We asked him, how old's your daughter? 5. So he wanted to be in good health for when she's old enough to get married.
Okay. Thank you for sharing that. Thank you all for being here. So March 26th is Diabetes Awareness Day. So please be aware. We're going to actually have this on Facebook or YouTube, so you can share it if you want to do that and share this program with them on the 26th. That we'll be glad for you to be able to do that. Remember, diabetes and hypertension, you can overcome that. Just get screened, and we look forward to seeing you next week. We will have a cooking show, and we'll talk about some of these factors then. Thanks for having us, and I hope you have a good evening.
Who's coming to cook?